Can bronchodilators affect other CF drugs? Bronchodilators play an important role in managing cystic fibrosis by helping to open up the airways. This process can enhance the effectiveness of other medications used in cystic fibrosis treatment. While bronchodilators do not usually cause harmful interactions with cystic fibrosis-specific drugs, they can influence how well these medications work. When bronchodilators like albuterol are used, they relax the muscles around the airways. This widening of the airways allows other inhaled medications, such as mucus thinners and antibiotics, to penetrate deeper into the lungs. For this reason, healthcare providers often recommend using bronchodilators before administering other inhaled therapies. This approach maximizes the delivery and effectiveness of these treatments. For example, short-acting beta-2 agonists like albuterol are inhaled prior to other cystic fibrosis treatments. This practice helps prevent bronchospasm, ensuring that patients can inhale the full dose of subsequent medications. As a result, therapies such as mucolytics and inhaled antibiotics can work more effectively by improving airway clearance. It is important to note that while bronchodilators primarily facilitate the action of other inhaled cystic fibrosis drugs, they can interact with certain non-cystic fibrosis medications. For instance, bronchodilators may affect heart rhythm or potassium levels when taken with specific cardiovascular drugs. However, these interactions are generally unrelated to cystic fibrosis-specific medications like CFTR modulators or inhaled antibiotics. There is some evidence suggesting that oral azithromycin, an antibiotic sometimes prescribed for cystic fibrosis, may reduce the effectiveness of inhaled tobramycin. However, this interaction is separate from the effects of bronchodilators. Bronchodilators do not adversely affect the metabolism or action of CFTR modulators, which are designed to correct the underlying protein defect in cystic fibrosis. That said, since CFTR modulators can influence liver function, it is essential to monitor liver health when starting or combining treatments. This monitoring is not directly linked to bronchodilator use but is an important aspect of managing cystic fibrosis therapies. In summary, bronchodilators are primarily used to enhance the delivery of other inhaled cystic fibrosis medications. They help open the airways, allowing these drugs to work more effectively. While there are some interactions with non-cystic fibrosis medications, bronchodilators themselves do not typically interfere with the action of cystic fibrosis-specific drugs. For personalized advice and to ensure safe management of these therapies, it is always best to consult with healthcare professionals.